remembers when so many healthcare workers, we're talking doctors, nurses, radiographers, even carers, so many healthcare professionals were being encouraged to move to the UK. Employers were easily giving jobs, offering visa sponsorships, covering flights, even visa fees. Some were giving temporary accommodations, just everything they could do to encourage healthcare professionals to move and work in the UK. But today, it doesn't feel like that anymore. In fact, we're starting to see something very, very different. Doctors, nurses, and other healthcare workers are beginning to leave the UK. In fact, they are leaving in their numbers, and it's worrisome. So what has gone wrong exactly? Why is it that healthcare professionals who were once encouraged to move to the UK and work are now leaving the UK? In fact, some have even left already. Let's talk about this in today's video and more, because this is really, really serious. Recently, a new report from the General Medical Council revealed some very worrying numbers, and we'll be looking at it in details. So it says nearly 1 in 5 doctors is considering quitting in the UK, new figures show, while 1 in 8 is thinking about leaving the country to work abroad. And it doesn't stop there. The General Medical Council, which commissioned the research, is warning that plans to cut hospital waiting lists will be at risk unless more is done to retain them. Now, looking at this report, when I was going through it, something came to mind, right? Just started thinking back about how a lot of healthcare workers were, being encouraged, were excited about moving to work in the UK, how, it felt like the UK really wanted this set of people. And there was a time, if you can remember, that they also exempted this set of people from paying IHS fees. You guys know how expensive IHS fees is, but the government, in a bid to say, oh, we appreciate you guys, we are encouraging people to come here, they scrapped IHS fees for healthcare workers, and it felt like, oh, we want you guys here. There's shortage of healthcare workers. The healthcare sector is suffering from labor shortage and everything. We need people. Please come and work. And we even remember a time when they also announced that carers were also welcomed. At that point, a lot of people were giving jobs to come to the UK and work as carers because they were in demand. There were shortage of care workers, shortage of carers, and the government lowered the criteria to be able to bring these people, lowered visa application fees. Of course, there was no IHS fees as well. So it felt like, oh, you people were really needed. Guess what the UK did? Immediately they got the number of people they wanted, they shut the doors. It just feels like this is exactly what keeps going on when the government wants any set of professionals. They lower the criteria and make it possible, do everything possible to entice people, to give incentives and make those people come. And then once they get the number of people they want, they shut the doors or tighten it and make it more difficult for such people. And this is exactly what is going on right now, because as it stands, is getting more difficult to get jobs, both for doctors, nurses, generally, healthcare workers generally. It's very difficult to get jobs now. And we all know that from now, carers and senior carers can no longer get sponsorship from overseas to work in the UK. So a lot of things have tightened up when it comes to recruitment, employment, getting jobs and everything. But the people who are here already, they are doing the jobs, are still complaining and are leaving. Okay, we have seen the numbers from the research consulted and posted here, because this research from the General Medical Council into how doctors are feeling about their careers comes after resident doctors staged a 5-day walkout, right? From this image here, as you can see, it says pay restoration for doctors, and the other one says 18.62 per hour is not a fair wage for a resident doctor. So reading on, it also says that the main reason doctors gave for considering moving abroad was they are treated better in other countries, while the second most common reason was better pay. So tell me, what else, when you remove pay and treatment, fair treatment and fair pay from your job, what else is there? If you have 2 jobs and job B has the potential of treating you better, giving you better treatment and paying you better, Obviously, a lot of people, maybe 90 or even 99% of people are going to go for the better paid jobs, okay? Because I'm sure when you were studying hard in school, reading so much, paying so much money, taking exams upon exams, upskilling, getting all the skills and qualifications and experience that you need, you were doing all of that with the hope of doing better in life, getting a good job with a good pay, and just basically getting the basics that you deserve as a professional in your field. So a lot of doctors and healthcare workers have always been complaining, especially those working for the NHS, that they're not well paid. Right? If you're a healthcare worker watching this video, please let us know in the comment section. Do you think your pay is fair enough compared to your colleagues, your counterparts in other countries, right? In fact, I'm sure we have read so many articles. They've been going on strikes upon strikes for a long time, complaining about the same thing, and it's about their pay. Now, some 43% said they had researched career options in other countries. For somebody to be researching, it means he's actually thinking about it. Now tell me, if these people keep leaving, what's going to be the fate of the healthcare in the UK? Like right now, we know how the waiting time is. Like I remember going for something, like they had to refer me, and when I called, they were like, you're on the waiting list and it takes 12 months, So I'm sure some of you have that experience where you have to be on the waiting list for over 12 months, just to see a doctor or see a professional. So it is like that right now. Tell me what's now going to happen when all those 43% of people, of professionals who have researched leaving, when they all quit their jobs and leave. Now, this isn't just about some unhappy doctors. This is a movement. Look at the numbers. It's really worrisome. It calls for concern. Just look at the numbers, okay? And remember, if these doctors feel like they're not treated well, if they're not satisfied, they're definitely going to look elsewhere. They're going to look at countries like Canada, Australia, US, or even other countries that they feel they'll be treated better. They are going to go there. And that is just the truth. And this is not just doctors, nurses as well. Other healthcare professionals, they will go to where they are definitely treated better and where their skills are more valued, or at least where they feel that way. I can even count up to 10 on the top of my head right now, both doctors and nurses that I met here in the UK working when I came, that have moved out of the UK. Like I saw them making plans and leaving the UK. And this is not just stopping. As we speak now, a lot of doctors are also making plans. Like we saw from this research, so many of them, over 43% of them, are researching on how to leave, asking questions, gathering facts and evidence, and just planning to leave, right? Some of them are also planning to quit their jobs and go elsewhere and work. Now imagine what's going to happen when all these people leave. And the interesting thing is that they are not employing people as much as they used to. Employment have slowed down with the continuous changes in immigration rules and everything. Employment have slowed down. Doctors, nurses, carers, basically healthcare workers are no longer getting that much employment. A lot of NHS trusts are not hiring as much as they used to. Some have even stopped hiring temporarily, and it just gets more difficult by the day. Tell me, employment is not happening, they're not hiring new staff, and then people that they have are leaving. Tell me, just imagine what's going to be the fate of the NHS. And trust me, I've spoken to doctors, I've spoken to nurses, some of them who had left the UK. And some of them, one even told me, he said it's not necessarily about the pay, it's just about the respect. He feels he's more appreciated, his skills are more valued and appreciated working in Canada, And then another person said the same thing as well, that he just feels like he's more useful working in that country than working in the UK. Obviously, they are paid better. If all those people keep moving to these countries that they feel, that are appreciating them and paying them well, what is going to happen to innocent patients? What's going to be the fate of the NHS, of the healthcare in the UK, especially now that they are not recruiting as much as they used to. Yes, money is very important, but recognition and respect is equally important, you know. So when they feel like they are getting that from these other countries, they are moving to Australia, Canada, US, and you know, those other countries that they are going to get that. Obviously, they're going to look that way now. So I know these reports only cover doctors, but trust me, it's not only doctors, even nurses, some even carers, other healthcare professionals basically are starting to think that way. They've been thinking that way, and some have even left. As we speak, some are writing exams that will take them out of the UK. Some are packing their bags and leaving. Some have left, you know, and some are researching on how to go about making the move, like we just read. So doctors need to be satisfied, supported, and see a hopeful future for themselves, or we may risk losing their talent and expertise altogether. Exactly. The Department of Health and Social Care acknowledged doctors had suffered more than a decade of neglect. Doctors have legitimate complaints about their conditions, including issues with training, bottlenecks, and career progressions, said a spokesperson. So they said their pay is not increasing, there's stagnant pay, you know, and they want their pay to be increased. As we saw on that image, somebody said they are being paid £18 per hour, you know. If that's true, how can you pay a resident doctor £18? £18.62 per hour. Come on, that's too low. Because tell me, your pay is not going up, but the cost of living is going up. The bills, everything is rising except your salary. And then they also complain about career progression. And also, I'm sure we all have been hearing how the NHS is understaffed and currently they are not recruiting as much. I just said that earlier. So it just means that people who are there are being overworked without adequate support and without adequate pay. And there's also the respect and the way that they are treated, because that is also a huge factor. Now, how about the constant immigration rules changes, the uncertainty, the constant dragging of legal migrants left, right, and center? Like, migrants are this immigration numbers, like, you just don't know the next thing that will come, the next rule that the government is introducing, you know, the next rule that will be changed and how it will affect you and your family and friends and all of that. So it's a lot to deal with, really, and I feel like this is one of the reasons why so many people just jump at the opportunity to leave. So honestly, the government needs to look at this critically and just see how it will affect the future of healthcare in the UK if they don't do something about it. Because I remember the government have said that by 2029, they intend to reduce the waiting time, you know. But if this trend continues, obviously it's going to be impossible. Another dangerous thing about it is people who can afford to go private will begin to do that. And then those who cannot afford that, what becomes their fate? I know, yes, they spend money, time, and everything trying to recruit professionals here. They do that very well. They're very good at that. But keeping them is the problem, because they are struggling to keep them, as we can see here. So they really have to do something about it, or put in as much effort as they spend in recruiting these professionals, to put in that same effort or even more into keeping them. So if the UK doesn't change course by improving pay of these healthcare workers, treating them better, you know, listening to their demands and trying to just solve it or meet in the middle, or at least reach an agreement, if they don't just listen to these people, we're going to see more and more professionals leave. And honestly, it is the patient, the healthcare, the NHS that will suffer for all of this, right? Now, let me hear what you guys think about this in the comment section. And have you really noticed people leave, doctors, nurses? Have you noticed anybody in your hospital, in your community, somebody that you know personally? Have you noticed? For me, I have seen, and I even know people that are planning to leave as well. Sometimes the conversation starts like play. I would really love to go here. I would really love to leave the UK. and the next thing they're working towards is taking the exams. The next thing they are leaving, and it just happens all of a sudden, you know. Have you noticed the same thing as well? Let me hear what you think about all of this in the comment section. Let's continue the conversation there. So yeah, that is it for today's video. Thank you so much for watching. I'll see you guys in my next one. Bye bye.